Okay, let's go ahead and get started. Okay, is there anybody here tonight for the very first time? Raise your hand if you're here for the very first time. First time to a doTERRA class. Okay, I want to send around some information here. Terry, would you see that everybody that is here for the first time gets a pack there? Okay. And has everybody signed the roll? Has everybody signed the roll? Except for now. Those of you who are joining us from online, please let us know you're here. Let me know your name. Well, welcome. I'm really excited to be here tonight with you, and I have Dr. Joshua Jorgensen here from Minneapolis. Thank you for coming. And we want to express appreciation to Dr. Shah, who has opened his chiropractic office to us tonight to meet. And so if you cannot see, change locations, okay? So we need to rearrange chairs, we'll do that. But then we want you to enjoy this. And I want you to be thinking of questions that you want to ask Dr. Jorgensen. We don't get this opportunity very often. And it's a wonderful opportunity to be here with a medical physician who uses these products. Welcome, Abel, who uses these products in his medical practice. So, Mel, would you see that Abel gets that roll and a packet of information as well? Abel, would you put Katie's name as the one who invited you on the roll when you sign it? Okay. Thank you so much. Okay, good, good. Well, let me introduce Dr. Jorgensen for a minute. I have a lot of respect for him. I have a personal relationship with him, and I really do love him and his family. And so you're in for a treat tonight, okay? He is an ear, nose, and throat doctor. Actually took out my son's tonsils and adenoids, so we do have a personal relationship on that end too. Okay? He has a medical degree. Very good, very good. Okay. He obtained his medical degree at Columbia University in New York, and did his residency here at University of Utah in head and neck surgery. He's just recently completed a fellowship, right, Josh, in Minneapolis with Dr. Michael Paparella, who was world-renowned for his work with the ears. And so I'll let Josh share that a little bit more. And he is currently in Minnesota, in Minneapolis, like I said, moving to Bismarck in a week, or this next week. He is the founder of Protocol.com, and he will talk to you about that. That is a wonderful resource available to all of us for online support, okay, and he'll talk to you about that. He has a special interest and expertise in the safe use of essential oils and as alternative medicine. And first and foremost, Dr. Jorgensen is a devoted husband and father. I've watched him interact gently, kindly, devotedly to his family. He does a lot, an awful lot, in service to his church, to his family, and to those around him. So, welcome, Dr. Jorgensen, with me tonight, please.
Thank you, everyone. So we're going to experiment a little bit with this. We're recording this as a web conference. So I might just try sitting here. I might also pick up the laptop and start moving around. We'll see. We'll see what works. So thank you, Debbie, for that very kind introduction. I know many of you, I've met several of you, both as a doctor and as a friend, and also a person who's also interested in essential oils and doTERRA. My wife is responsible greatly for me being here, and so is Debbie. So I'm going to tell you a little bit more about that. But what I'd like to do today is talk about this idea of engaging medicine for doctors or healthcare professionals in what we're doing with essential oils. This has been the big question that I've been trying to answer and trying to address as I became more familiar with essential oils and as my wife continued to prod me again and again to use these on my patients, which I eventually did. So I'm going to tell you about that process and where we're at. So what I'd like to do is share with you my introduction to essential oils, how I came to know and love essential oils. and how we use them in our home. I'm going to share some what I consider miraculous patient encounters with essential oils and ways I've been able to help some patients who haven't been helped in other traditional ways. Start off right. This is kind of a new idea I have, which is those of you who are new to doTERRA, new to essential oils, and you don't know where to start, if you can somehow engage somebody, a health professional who knows you, knows something about you, then you can start off leaps and bounds ahead of where you might do if you're doing it on your own. And last but not least, pearls about a successful medical health practice. I wanted to share you some insights about what it's like to be a doctor and to provide care for patients because all of us are wellness advocates and trying to help other people with their health. And this might help you with your business if you're doing doTERRA as a business. It may also help you just with your interactions with your family and friends and how to help them. So I meant to put in another slide, and the first slide was supposed to be who I am, because who I am isn't necessarily what I do every day. And you'll see a great picture of my family at the very end of the slide, and that's the one I wanted to put first, but you'll see it soon enough. But above all, I'm a son of my parents. We have 9 kids in our family. I'm a brother to my brothers and sisters. I'm a father to my kids, and I guess I'm a friend to all of you. I'm also a doctor. I'm an ear, nose, and throat specialist. I've also, as Debbie mentioned, recently got additional training in the ear, so I did a fellowship in the ear, where I've learned more techniques how to reconstruct ears and the hearing mechanism, and also how to treat chronic conditions, including infection and dizziness related to the ear. One of the most pleasurable things I do is do cochlear implants. This is an x-ray of a patient just immediately after I've inserted an electrode into the cochlea, and then this is a close-up of the electrode coiled into their cochlea. And this is one of the most satisfying things for me, to help restore hearing to a patient that has lost that ability to hear and cannot communicate with their family and loved ones. I also, believe it or not, as a surgeon, do a lot of medical management. I would say about half of the patients I see, I do not, well, greater than half, I do not do surgery on. And greater than half do not have a surgical condition. So I'm actually prescribing a lot of medications. And my comfort in using essential oils as an alternative medicine or complementary medicine stems from my practice and experience using regular medication. So I want you to understand that. And the reason why I felt comfortable eventually to integrate essential oils is because I realized I'm learning with my patients every day and getting feedback from them on traditional medications. Why not use something with less side effects that could maybe fill in some of those gaps in our healthcare? And we've had some great successes with that. So why is a doctor talking about essential oils? Well, it's actually kind of just a coincidence that I am also a nose doctor, and that's not really the origin. But anyway, I think it's kind of ironic. Actually, I owe a lot to Debbie Gordon. She mentioned that her son was a patient of mine, but before her son was a patient of mine, she was actually taking care of us. You may know that she's a nurse and also a professional doula or a birth coach. And when we interviewed her in her home, she brought in the essential oils. She brought in a diffuser and immediately made us feel calm and relaxed. And I almost fell asleep, Debbie. I was sleep deprived at the time, but my wife felt very comfortable, and it made a huge difference in the birth of our son. And Debbie kind of came to the rescue during a very hectic moment where we had interactions with doctors and nurses and people that were just kind of really seemed like almost as stressed as we were. And Debbie was really a calming one with essential oils. So I thought that was pretty interesting. So we really did rely a lot on Debbie when we first got introduced to the essential oils. Elena one day went to a class where Debbie taught her some things. She brought home a book, Modern Essentials book, and a box of essential oils. I won't tell you how much she paid for those. But as time went on, we kind of wish we would have started with more, and we've eventually developed quite a library, I guess, or a collection of essential oils. I'll show you some pictures proving that a little bit. But we didn't, as far as using the essential oils for our health concerns and our medical issues, we didn't know where to start. My knee-jerk reaction has always been, where's the medication? And Elena has always kind of resisted me a little bit for that reaction. And she really didn't know, she really didn't have a backup, a alternative for our family until she met Debbie and got the essential oils, the doTERRA essential oils. So it's really changed our family. Another very influential person, Dr. Paul Winterton, I actually texted him today. He didn't talk to me, he was doing surgery. But anyway, one of the things I remember most about those initial interactions is he challenged me. I'm going to call it the PubMed challenge. He challenged me to do a search, literature search of essential oils and health conditions that I treat. And he said that I'd be surprised what I find. And sure enough, that's been the beginning of what we now have as Protocol.com, and this idea of research-supported alternative medicine using essential oils that are therapeutic grade. So Dr. Winterton said that every doctor, nurse, and health professional should do this challenge. So if you're out there, if you can hear my voice, consider this a challenge from Dr. Winterton through me. So I learned during this process from Dr. Winterton and from my own research what essential oil is. And this is my favorite way of thinking about it. Essential oils are nature's medicine that helps the plants heal when they get injured and they get sick. And so this is something that that God gave the plants, programmed them to have so that they can heal themselves. Well, we have that too. We have an immune system. But we also have the benefit of having these natural resources so that we can use those also for our own health and to share them with our loved ones and show compassion towards others. So, believe it or not, most medications are actually either derived from natural substances or synthetically derived based on a natural substance that has therapeutic properties. And I think we kind of forget that in this modern age. Aspirin actually originally was derived from the willow tree, the bark of the willow tree, and the salicylic acid that they were able to extract from this. When they combined it with other chemicals, they produced aspirin that eventually become really the single most wonder drug in our time. They actually later, because of some of the effects of this super concentrated drug that they created from the willow tree, they actually synthesized a different version to deal with those side effects. And I think that's kind of a theme in healthcare, you'll see, is we have these very potent medications, we have side effects, and constantly we're dealing with the side effects. How often, if you've had to take one medication, that you've kind of been forced to take another medication to deal with the side effects from the first? Very common, isn't it? We prescribe antibiotics, antifungals together because our body needs to be in balance with the bacteria that live with us and the other organisms that live with us. So, doing the PubMed challenge. So I took Dr. Winterton's challenge, and I started very basic search. So I wanted to learn more about lavender, and I just searched chemical properties of lavender essential oil, just as simple as that. And this is what I found. Well, first of all, you can find some really cool pictures online of lavender. But for those of you who may be new to essential oils, these little pockets, or these little round things on the lavender leaf up close, those are the little packets of essential oils. Okay, so to get enough to have a bottle of essential oils, you have to get many leaves from the lavender plant. Okay, but this is what it looks like under an electron microscope, which is some of the technology we have. So if you study the essential oils and you do this what's called a gas chromatograph of the lavender oil, you see several spikes on that test. And these spikes all correspond to a different chemical that exists naturally in this oil. The height of each spike has to do with how much of it is in there compared to everything else. So you can kind of just see what percentage of these different things, these main components, make up this essential oil. So in this paper, one of these first papers I found, it actually listed from some studies they did all the components of lavender oil, which you can see there's 47 in this particular batch. And there were 4 main components corresponding to the spikes. And this one, the longest name, I'm not going to even try to pronounce it today because I messed up in the past. This is the main ingredient. Eucalyptol is an ingredient in lavender oil, but it's not one of the main ones. In eucalyptus oil, it is one of the main ingredients. Okay, there's a little bit of camphor in there, and then there's this other ingredient here. Okay. All right. So, and this is what those chemicals look like. So we're now looking inside of those packets, and we're seeing all these different chemicals. All right. Okay. So this has a name. It's called beta-ocimene. And down here, these molecules, there's 2 different forms, linalool. So that's not too bad. All right. This same article actually talks about some of the properties of lavender essential oil. It's a natural antioxidant. Okay, and it demonstrated that it actually inhibits oxidation, or the free radical formation, which actually can damage cells during inflammation. It's a natural inhibitor of this process. It also, the same study, talked about the antibacterial properties of essential oil. So, when I first learned about essential oils and someone told me that lavender is great for anxiety, it's great for rashes, it's great for infection, I was like, okay, come on, give me a break. But it's actually true, and it's because there are several different components in these oils, and different oils have different strengths based on the percentages of the main components in the oils. Okay? So Dr. Winterton keeps coming back, and he's kind of here in spirit, although he's not here physically. Hopefully he's not still in surgery at 7:30 at night. But he talks about this. How should we as professionals think about essential oils? Are they perfume, scents, flavors? Well, those are characteristics of the oils, but you can actually mimic all of those by synthesizing perfumes and scents and flavors that don't have all their natural properties, the therapeutic properties of the oils. So I love this term from Dr. Winterton, therapeutic grade bioactive aromatic compounds. That is an essential oil. Okay. So, all right. So this PubMed challenge kind of festered in me, and initially I was kind of overwhelmed by it because there's so much out there. But eventually I was looking up anti-inflammatory properties in essential oils, analgesia, pain properties in essential oils, treating infections, including MRSA, sinus irritant infections, things that I treat all the time where patients don't do well, migraine. And it slowly started to become an obsession for me, this PubMed challenge. Dr. Winterton should have known better that I have these tendencies, addictive tendencies. But anyway, so I'm just don't worry about writing down the details of these. We're recording this if you'd like. I just want you to have an idea of what's out there, okay? So this was one of the main papers about the antioxidant, anti-inflammatory properties of essential oils. It's a great review. And here's the inflammatory cascade that naturally happens during stress or injury of the body. And you have arachidonic acid that leads to prostaglandins, which leads to all these natural substances that's released at the cellular level. And that is what causes our symptoms. That's what causes us to have inflammation, swelling, itching, redness, leaky capillaries, swelling. Everything stems from this pathway. Well, aspirin, this wonder drug, and later ibuprofen, they block one of the main components of this pathway, and that's why they're so effective. Okay. So, this cool article also talked about several essential oil components in essential oils that also block these pathways, including, for example, eucalyptol, limonene, eucalyptol and limonene. Let's take those two examples. So this is what those molecules look like, and you can see there's a similar look to them as aspirin. And we learn in organic chemistry in pre-medical school that function follows form. So the properties of the oils have to do with how they look, how these chemical constituents look physically, and how they interact with our tissue and the molecules in our body. So D-limonene, that's in all the citrus oils. It's also in peppermint, eucalyptol or 1,8-cineol, and eucalyptus, peppermint, lavender, etc. Aspirin is just an aspirin. It's not as cool to talk about, but it's aspirin. Tea tree oil. So many articles out there on tea tree oil or melaleuca. This is a randomized study that talked about tea tree oil used to effectively eradicate MRSA. This is one of my favorite pictures. This is a colony of bacteria, and it's a biofilm. It's where the bacteria has kind of come together and join forces to protect itself against us, against our immune system. We could learn from bacteria, right? We need to stick together and keep each other safe. So the biofilm is not safe around melaleuca. 1% solution of tea tree oil eradicated that biofilm in this study. Tea tree oil is also antifungal. It's a great to treat against candida and other types of fungal infections or yeast infections. I found a study as an ear doctor that it can help. It's been effectively shown to treat outer ear infections. So that's something I can directly use as a doctor. That same study talked about how well it can treat staph, and specifically resistant staph. And it's almost as good as some of the strong antibiotics if you use it the right concentration in the right ways. Okay, essential oils and their properties of treating pain. Well, this is a great article. It talks about monoterpenes, which are just these other types of molecules that all have properties to relieve pain. Here's that eucalyptol, okay, that we saw in lavender. Here's linalool, that main ingredient in lavender that I couldn't as a doctor say the name in front of you tonight. So lavender has natural anti-pain properties. There's a recent study, I don't have it up here, and this would have been helpful for some of my patients, that just diffusing lavender essential oil after a tonsillectomy decreased the need for pain medication in patients. And that was a well-done study. So some of these anti-pain properties are in lavender and eucalyptol. Hence, lavender is great for migraine. It's got anti-inflammatory properties. It helps with the migraine. It's got anti-pain properties. Eucalyptol is great for sore throat. Debbie and I worked together and wrote the sore throat protocol, and one of the ingredients in that is eucalyptol. Now, you can't ingest eucalyptol at high amounts, but in the amounts in the protocol is safe. And we've learned that from studies from patients down under who were taking way too much eucalyptus, because that's where eucalyptus comes from Australia. But eucalyptus, if someone has like I don't know, a liter of eucalyptus and drinks it, then they can get severely lethargic and have problems. So anyway, there's little kids overdosing on this. But in the amount, 1 or 2 drops here and there, it's actually very safe. Cinnamon essential oils, natural anti-pain and anti-inflammatory properties. Cinnamon is in the On Guard blend. And it's not just to make it taste good, which I think it tastes good. It's in the toothpaste, On Guard toothpaste. It actually has anti-inflammatory properties. And then this study also looking at migraine, how peppermint, with or without eucalyptus, can really help with headaches. Okay, I admit, I'm a little obsessed by this PubMed search thing, and it may even be an addiction, I have to admit. The last talk I gave, I admitted to everybody that I was an oilaholic. And it's kind of a funny idea, but I think the oils are safe. I don't think you can get addicted to the oils, but if they really help, then you should keep using them. That's okay. You heard that from a doctor. Okay, so what are essential oils? After all this research that we've done, they are complex chemical compounds with multiple healing properties. So the same oil can be antibacterial, antifungal. It can have antiviral properties, antioxidant properties, and it can treat inflammation. So this is real, and it's now being shown in the medical research. Each of the oils have 3 to 4 main ingredients. So that's how we should think about these oils. They're different recipes that God has made for us to use. And certain recipes are good for certain things. So what is the difference between medication and essential oils now? Well, you can see the difference just looking at these pictures. Medications are single molecule or compounds that are hyper-concentrated, that in general have a single mechanism of action. And they can have a lasting effect. You can be addicted to medication because they can be so potent, and they can change your body's ability to respond to pain naturally, for example, with narcotics. And so they can have a long-lasting effect. They can cause side effects for these same reasons, and they can be addictive. Essential oils, on the other hand, are complex multiple chemical mixtures that have varying concentrations of the chemicals, so they're balanced. They're naturally balanced mixtures, okay, that are found in nature. With multiple mechanisms of actions, multiple modes of actions, and they're aromatic. So that means they're there, but they go away. So you don't see the side effects with essential oils that you do with medications for this one main reason. Okay? So, multiple mechanisms of applying the essential oils. Well, you can't take aspirin. You're not supposed to take aspirin by inhaling it and eating it and applying it topically. You can't put it directly on the brain, for example. So there are limitations with medications, but essential oils, you can inhale them. You can directly stimulate not only the olfactory system, but the systems that are connected to that, which relate to your mood. They can be absorbed directly into your lungs by inhaling them, okay, and get right into your bloodstream. You can ingest essential oils, and they can get right into the capillaries here in the small intestine. And then you can apply them topically. So that's pretty cool, don't you think? You can have essential oil on one bottle, and you can do just about anything that you need to do for your health with that gift. It's a little loud. Okay.
And those of you who would like to have one about peppermint is really strong. I suggest that you put your hand on the bottle do this rather than take a full drop because it's very strong. Okay. Try some of that and lick it. Everybody check your tongue. Do that, some of it on the back of your neck, or if you're having discomfort anywhere. I always go to the back of my neck because I always have tension back there. Put your hands together and smell it. Pass it around. Okay. Now, does he convince you that they're antibacterial? So if you put your hand on my bottle, we're not sharing germs. And so go ahead and try that and use it those 3 ways, aromatically. Now, the hand, let's rub your hands together. Notice what happens in your mouth when you taste it. Notice what happens when you apply it topically.
Okay, if you can't hear me on the mic, Debbie is now convincing the entire audience here to put peppermint everywhere on their body, to inhale it and to put it under their tongue. I have to tell you that this is one of my favorite things to do. Today, I actually flew in this morning. I got up pretty early. I've been moving. It's been a long day. When I was preparing this, doing some last-minute preparations for this talk, I had to put some peppermint under my tongue to stay awake, to get me going. And it's really good. But the first time you do it, it's watch out. It's pretty fun.
You okay?
Yeah.
Telling it there instead of holding it out.
So let me tell you about my own personal experience with the oils, and then how my family uses it, and then I'll tell you how I use it as a doctor. So first of all, I work very hard. I carry all my tension here and here, depending on whether I'm doing surgery or seeing patients, and probably every single day, except for maybe not Saturdays or Sundays, depending on the weekend, I use Deep Blue Rub. And, okay, maybe I'm addicted to Deep Blue Rub. So I have sinus infections. I get migraine headaches related to my sinuses, my allergies. I use peppermint and lavender for my migraine and frankincense. And I use tea tree oil, melaleuca, and lemon, and I put it in my sinus rinse. And I rinse it up into my nose. My patients do that too, by the way, and so do my kids. I'll show you that in a second. With a neti pot or a Neilmed rinse or a saline, depending on how you do it. It depends on the experience you'd like to have. If you're new, I suggest start with 1 drop. If you're just tired of this infection, you might do more. Okay, I'm going to share a little early experience about a patient. She saw me because she previously had sinus infections. She came to me, and I had to decide to do surgery again on her, and I did decide to do this. And she still wasn't better. We sent her to an infectious disease doctor who was going to put in a PICC line and give her long-term IV antibiotics. Well, in the meantime, I've been kind of talking to her on the side about essential oils, and so she just came up with her own protocol of using tea tree oil in her sinus rinse, taking oregano internally, and by the time they cultured her at the infectious disease doctor, the culture was negative, and she was better. And when I saw her back in clinic, I was kind of like, was not too excited to see her because I didn't want to hear her complaining or whatever. I was not. I knew that if she was still sick, I would be let down by not only myself but my colleagues I sent her to. But anyway, she said, "I'm doing great. I'm better, and it's not anything that you guys did. It's the essential oils that I did to treat myself." And that was kind of neat. So, On Guard gel caps. I've used this when I'm feeling like I'm getting sick. My wife uses this a lot. She's using it right now, probably the very second. And then we use the supplements, the Lifelong Vitality supplements as well in our family. Okay, and if you want to know, there's a lot of really cool things in there. Those are safe and natural. And but sometimes you do need to take these things into consideration. All right, my son, this is my son Axel, I don't know if you can see. He's 2 years old. He inherited some bad genes from me, and he's actually been having chronic sinus problems. And he recently underwent surgery for his sinuses. The surgery he had was really a procedure. It was just a surgical alteration. It was just irrigation of sinuses. But whatever was growing in his sinuses got let loose. And after this procedure, he got severely sick. My daughter, who had been fine, she got severely sick. This was just this past week while we're getting removed. So both of them are sick. My wife gets sick. I'm the only one that doesn't. It's probably because I'm taking the Lifelong Vitality. I don't know. But anyway, we use the essential oils to help our family get better. My wife, she's been doing On Guard internally. We've been diffusing teacher oil On Guard for all of us. My son, we've actually, see these bottles here? This is Ayla's bottle and this is Axe's bottle. These are little saline bottles. We put the lemon and the Melaleuca in these bottles, just a drop or two of each. And the kids hold the bottle and squeeze it themselves. So the kids squeeze the bottle into their sinuses. And the fact that they're willing to do that, it speaks a lot, actually. It's tolerated and it's actually helping them. So we did a little experiment, not by choice, but by default. My son, because he had surgery, he was actually put on a course of antibiotics. We had a big debate in our family, and we decided that if we could come up with a protocol to use the antibiotics along with the essential oils, then this time that it was okay. Because he had been struggling for so long, because he was getting so sick afterwards, we felt like he needed it, and I, in particular, as a doctor, thought that he needed it. So my wife conceded, but we did make a decision as a family, and he did pretty good. He did pretty good. My daughter, she was sicker. Okay, she wasn't on the antibiotic, so she was sleeping more. Her fevers got a little bit higher, and one time my wife called me, this was earlier this week, and she said, Josh, Ayla's really sick. She's got high fevers. And my first reaction was, well, do we need to take her to the doctor? And she said, no, I'm just telling you so that you know, and I'm doing the essential oils. And I said, okay. And the same thing with her fevers. When she was having fevers, I was feeling so bad for her. I just thought she needed something. Elena said, Josh, use the peppermint on her feet. So I did. I rubbed it. She always has me do it for some reason, but I rubbed it on Ayla's feet again and again, and the fever, every time I checked her again, the fever went down. In 2 days, she was feeling a lot better. In 3 days, she was feeling enough to go play with her friends, and she was back to normal. In this day of modern medicine, we as patients and as doctors need to be patient. Okay, because I think anxiety and the fear of complications and the fear of what will happen if we don't take a medication is what's driving our decisions. And so the essential oils are kind of, in that sense, empowering because they give us something else to do so that we can be patient and let things take its course. And the essential oils can help us get better safely. So now we're moving and we're getting all of our essential oils because we have to take them everywhere we go, right? So this is before we pack them, and this is the box with this collection I told you about. And these are the ones that aren't opened. So anyway, I threw them all into the box, and I was like, hey, we got to put them all in the same box. And she's like, no, Josh, we need to pad the bottom, we need to protect the oils. She wanted to protect our babies, the essential oil bottle. So she did. So this is before she did that. Okay, back to health professionals. How can health professionals rely on essential oils for a consistent health benefit for their patients? I think this has been one of the biggest struggles for doctors to use natural remedies because consistency has been a problem. Well, this is one of the reasons why I feel comfortable using doTERRA essential oils, because they have a very high standard so that there are no impurities in the oils. That makes the oils last longer, and they make sure that the oils have those specific ingredients in them that make them therapeutic. So they guarantee this grade, and so I feel comfortable getting consistent results with my patients, and that's what I've seen. So how can health professionals feel comfortable recommending them and prescribing them? Well, I guess it's just a repeat of the last slide. We have the internal standards. We're going to have more and more standards and more research that we have. And at some point, we have to use them and develop experience with them. So that's where the protocol website, that's how it came about. It's from my attempts to integrate these gifts from the earth that have been purified in a very incredible way so that they are therapeutic grade and they are consistent, so that I can use them to fill in the gaps of healthcare for my patients when they have problems with therapy or when we don't have a good treatment for them. So we need to increase patient awareness, provider awareness about essential oils. We need to gather the research together, develop treatments protocols with professionals, test the protocols for their effectiveness, and we need to be engaged together, the patients and the physicians together in this process. It takes the cooperation. So we have many resources online. I've just highlighted a couple here. The aromaticscience.com is growing. They've updated it recently. It's got a nice look to it. We have our website that I've developed along with other professionals, and I haven't, although this aha moment that I had of this is how we need to do it. This is how we need to integrate it. This website came from that. It's taken me together with many other professionals and all of you to bring this to fruition where it is right now. And Debbie, you probably remember when we were in our home and we were talking about which protocol should we write first. And so Debbie, the one that we worked together, that was one of the first protocols for sore throat. Mm-hmm. And it was because her son had sore throats and we were considering intervention surgery for her son. And we needed to have a protocol with essential oils. So what can you do on the protocol website? I actually would like to demonstrate a few things for you. But you can interact with professionals. By the way, this is really hard to do to get a doctor's attention. I'm a doctor, and when I try to get another doctor's attention, I think they can get a little annoyed by me, or they're just super busy. So this is hard to do. I want you to know that. If you come on the website and are asking questions and you want help, remember that it's hard to get the doctor's time because they're so busy doing what they do every day. So anyway, it takes time, but I think it's working. So you can browse the articles that we've researched that we put on there, and you can be part of the blog and share your experiences along with the doctors, ask the questions, and get feedback. Tell us what's working for you. So it's meant to be interactive. So if you're doing doTERRA as a business, the protocol website can be a resource for you to help validate this. So you bring people there and show them this is the research behind this, and you can use this not only for your wellness and your to prevent things, but also to treat conditions if you use them the right way. So the other cool thing is you can create a profile on there where you say stuff about you, and the people that you bring to the website, you can have them interact with you, see your profile, and if we can get it working really well, there's even a way to connect on a network. So the people that you're helping with protocols, you can keep track of those people, and they can, when they're on the website doing the protocol, they can actually reach out to you and ask questions. Okay, so this is my cue to go to the website and show you a few things. How are we doing on time, Debbie?
We're doing great.
Are we doing good? So, is this going to show on the any meeting?
It may not.
Okay. Is there a way to do it so it will?
Are you in there already?
So I'm here.
If we do a share screen.
Okay.
Try that.
Just. Okay. So now, I think this is working. So here's the protocol website. First of all, you can go and look at the protocols that we have on there. Okay. One of our more recent protocols is one on allergic rhinitis or allergy. You can check out this protocol. You can check out some of the research that we've done. And these are the experience of the person who wrote the protocol. This is actually a natural health practitioner, acupuncturist, that I've been working together to write this protocol, which I think is pretty neat. Summary of the research. So each article that we're citing in the protocol here, we summarize. So you can read the summary and get a little bit about it. This is really good for doctors that need something to do. You can send them to this website and have them read all these. And then it talks about the different natural things that are listed in the protocol. And there's even a link to the doTERRA site through here where you can direct people to the site and then have them go and get the things that you need. Okay. So once you get into the protocol, let me show you. I'm going to sign in. Or I could just sign in with Debbie's.
Great. Actually,
okay. Oh, then we need to upgrade.
yes, I do.
Okay.
So just a question about that, so just make sure that I'm clear. Because I went on and I don't know how exactly it was I set up.
Okay.
Because there's two different links to the top and that you get it. Just verify that.
Yeah, so you can go on there for free and just browse all the protocols, look at all the research, and do it to that extent. So you'd be surprised. It's an incredible resource, but it takes funding to keep this going. And so the funding comes from the memberships. So if you want to use the protocols, or if you want to use them and share them with others, then you join as a premium member. It's only a couple bucks a month. It's not very much. You can even use it for a period of time and then go back to the basic if you need to. And that gives you access to ask the professionals questions, to get that resource from the professionals, and to do the protocols. So that ideally, you or someone you're helping with is doing the protocol, and along the way, if you have questions, the professionals on the site or the professionals that you brought to the site to engage with are helping you through that protocol.
So are these like these specific are there that obviously we have different specialties or things? So is this something where you can do it as a member if I have someone that I'm working with who has a certain type of ailment, if they're wanting information on that's where I would go and ask a professional.
That's right. So the question is, are there going to be professionals in every area so that if I have a particular concern, I can go and ask that professional? Yes, that's where we're headed. We have a lot of professionals on there, but not covering every area. And what we're doing now is we're just researching the topics as they come. If the topic is related to orthopedic surgery, for example, Dr. Winterton will give advice and give suggestions. If it's related to ENT, I'll do it. If it's related to some, allergy, Kristen Horner-Warren will do it because she helped write this protocol, or I'll do it because I have experience with allergy. If it's something that needs more help, I'll throw it out there to the other professionals who we're interacting with and see if anybody has any experience. And when we're just scratching our heads, then we go and do the PubMed challenge. and continue that obsession that we have as doctors, looking up research. So anyway, it's going to grow, but I'm going to talk to you in a little bit about how we can all help it grow. Okay, so if I'm in the protocol, going back to this, protocol steps, this will tell you exactly what to do, exactly how to apply the oils for this condition. Okay, so it's a step-by-step guide. In this case, it's for allergy. And it's similar to the sinusitis protocol where you're putting it in your sinus rinse for prevention, and you're using different essential oils. You're using lemon in the sinus rinse, for example. Most of these protocols are built so that you can either you or other people that are doing them can learn how to use the essential oils or the supplements in all the different ways. Topically, inhalationally, or aromatically, or internally by ingestion. Okay. So the protocols are built to help people get started with the essential oils, or to help them at a certain time where they need to know how to treat a certain condition. Okay. So you can interact with professionals on the site. These are just the most recently active professionals. Eventually we'll have the full list here. But if you go to one of the protocols, you can, for example, go to this protocol about treating nausea naturally, and you can see it's by Dr. Winterton. You can just click on his name, and you can see his protocol, or his profile. You can send him a message. You can add him to your network. So, this will be something that will come to play as we're engaging together in this process. Okay. The products tab is just a way to get into the doTERRA page so that people can order essential oils. And it has some instructions to teach them how to do this. Okay. And it's pretty self-explanatory, but it takes them right into the doTERRA page and it allows them to stay on the protocol page to refer back to the protocols and what things they need and still be able to order.
Now they would need to have the wellness advocate member ID number.
That's right. That's right. So this doesn't work for just some random person searching and coming on the site saying, I want to get essential oils. It works the same way that doTERRA works, where you have somebody who's introducing someone else to this, and they help them through the process. Okay. And then we have the blog, where you can see questions that are being asked, okay, and different articles that are being posted on different things. So, see if there's anything on this one. What protocols do you have for sinusitis? And we referred back to the protocol, but also addressed the specific question that was asked and talked to that person about what they've tried so far, what's worked, what suggestions we have. And you have different people interacting here. I think the blog, I think you can just access the blog and read it. But if you want to ask the questions and participate, then it's part of the premium membership. I think that's how it's set up. Okay. So, and there's some great examples of this too. So I encourage you to go search that. Okay. If you are a premium or professional member, you can go over, and these tabs will work, where you can create a protocol or write an article. This is another thing to get your doctor friends who need something to do. Send them to this page and tell them that there's a database of all the essential oils from this website, and say that they can log on to the database and play around on EndNote. That's one thing that doctors like to do, where they like to play around with these programs that help us write scientific articles. Doesn't that sound fascinating to be a doctor? Anyway, so the database comes up here. It's loading here, but it's another website that we have our own account. And when you log into this account, you can see all the articles listed by which condition and for different conditions. And as we're blogging and researching, we're putting all the articles there. So that is an incredible resource that we need to tell our doctor friends about. Okay. And then, oh, by the way, that shows you if you're helping someone write a protocol, helping a doctor write a protocol, this tells you how to get started. So let's say you have a medical condition, the doctor's trying to treat you, you want them to integrate some natural things. They don't feel comfortable. You can say, well, why don't you help me write a protocol so that we can follow this, do feedback, do some research on it, and you'll feel more comfortable doing this and being part of this this journey that I'm doing. And you can help them do that. And so that's how the allergy protocol came about. It was someone blogging on the site who was interacting with me. I was interacting with their ENTs here locally, and we all came up with a protocol. So it was pretty neat. I think I have to get back to my presentation. Oh, okay. So Debbie, how do we end the, how do we go back to the presentation? Turn off the share.
See, the PowerPoint. And we might need to bring it up again and click her out. Click on that one first. And then open presentation. Oh, already being shown. Okay, please show me where it's at.
Sorry, being shown.
Okay.
Oh, I think I just have to click it here. Oh no, it's here.
Is it right up?
Yep. Okay. All right. More stories. How do I use the essential oils in my practice? I use them as complementary medicine for failed medical treatments, when patients have side effects or when they're wanting to avoid side effects, as an adjunct, so together with medication or surgery, and when there's no good medical treatment. I also screen my patients because, remember that first question I asked, why is a doctor talking about essential oils? I've had patients ask me that. Why is a doctor talking about essential oils? And that patient obviously is not ready for that discussion, I guess, or they don't want that discussion. So I have to screen my patients and make sure that they're comfortable with this. And I think it's mostly reassuring to my patients who are already doing this that they feel comfortable talking to me about it. And that's what I think needs to change as we engage our doctors and our professionals. So those who are seeking it out, those who want to focus on prevention, lifestyle, I think that oils do promote self-awareness, so we're more in tune with our bodies and what our bodies need and how we're responding to things. I think drugs can be numbing, and so it takes us away from that process. To discourage people away from drugs that could be addictive, and just for overall wellness. So there are many complaints that I see as an ENT, and I want to go over a few of those. Earaches. I have so many patients that I see that have their ear hurts and I can't find anything wrong. I actually think it's a form of a migraine, and I treat it like that, but I treat it usually just topically with these agents, because usually it's not severe enough that they want to go down the route of narcotic medication. And I don't usually do that for migraine anyway, but that's how I treat it. Sinus infections. So I have patients who I treat when nothing else is working, or for prevention of chronic sinus infections with melaleuca, lemon, and oregano. I do not tell my patients to put oregano in their nose. It hurts. But we talk about ways that they can take it internally or topically on the feet. Okay. Sore throat. We have a sore throat protocol that has essentially all these things in it. I have patients who I've given this protocol to after surgery, and the kids are asking the mom for the spray. I've had patients not use narcotic medication, which is pretty standard after tonsillectomy because of how bad it hurts, because they're using this sore throat spray. Sounds kind of hokey, right? But no, it has these therapeutic grade essential oils in it, and it helps. You can suspend it in oil. It has a different effect when you suspend it in oil or water. If you suspend it in water, it's going to penetrate more, so it might be a little more potent, but it might not stick around as long. If it's in the oil, I think it might stick around longer. It'll taste differently, and it'll feel differently. So it's a preference thing. I think in the protocol we use the coconut oil, but I've had patients just use water too, and that works. I
started with water after Benjamin
Yeah.
So it was still dry. And so then I added the fractionated coconut oil and it kept the throat moist for a little bit.
You learn to be self-sufficient as doctors. No one's taking care of you. So let's see. All right. So loss of smell. I've had patients miraculously get their smell back a couple times now from just smelling as many different oils as possible, as often as possible. We are actually working right now and almost coming out with a protocol for loss of smell. And it has to do with this idea of retraining your olfactory system. So it's a retraining therapy. And it might work neurologically, it might work by anti-inflammatory means. It's probably a combination of both. But either way, we're stimulating the brain through the system to be able to sense smell again. And maybe even treating the underlying cause. Ringing in the ears. We don't have any good treatment for this. We need to do some more research and find a protocol that works for this. This is one of our biggest things that we have failed with as an ear, nose, and throat doctor. Cannot treat tinnitus. And I think we can come up with something that can really help. So how do all of us engage our health professionals? I have to tell you that when my son had surgery, we had to forcefully tell the anesthesiologist that we do not want Zofran for the surgery. And he said, oh, really, why? And we have some natural things that we want to do instead. And so we used ginger and peppermint before and after surgery, and he did fine. But the doctors have it part of their protocol to use Zofran with every surgery so that they don't have a complication, so that they have a good track record as a doctor. So you have to interject your preference. You have to do it in a tactful way, okay? You have to educate the doctors just like you want them to educate you about why they're doing what they're doing. You have to be nice. And one of the nice things you can do is, if it's a doctor that you have, not a doctor you're meeting for one time, but a doctor you have a relationship with, you can spoon feed or give them an article that shows an essential oil for the condition that you're talking about. They will read that article, and the next time you talk, they will be more open to talk about it. You can tell them to go to protocol.com. You can give them the PubMed challenge. And this will drive them crazy because this idea of searching essential oils on PubMed, it'll sound ridiculous, but it won't. It'll be in the back of their mind until they just have to do it, okay? And if you are getting treated for a health condition, you can engage them in a personal wellness plan for you and help them decide how much of the standard treatment you need, how much alternative, how you combine, and where to draw those lines. So we have this idea with protocol.com of bringing the professionals together with the patients and the products here at this website and protocol. And this is where we come up with the protocol wellness plan. Okay. To do this, I need your help. I need you guys to bring more professionals to the site. If you bring someone who's part of your team or who's supporting your doTERRA business, or who's a good friend of you that's supporting what you're doing, if you bring them to that site, they will help you. They will help you, but they don't know where to start either. They can start by studying the research that's on the site, helping with the site, becoming a professional member, starting to write articles based on the research that they're doing. They can write a protocol with you. And they can do this personalized protocol wellness plan with you for your condition. You may be somebody that already has the essential oils and you're using them in your daily life, but you need to use them for a certain condition. This protocol wellness plan will work for you because it will tell you what to do until you get back to your normal routine. You may be someone that has never used the essential oils before and you don't know where to start. This is a mechanism for you to start. Anybody that is here today or is hearing me today, I'm going to make a deal. Okay. You may not be part of my wife's doTERRA team, That's totally fine. But I'm going to make a deal. If you guys have somebody that you want that wants to buy the essential oils, but they don't know where to start, I will help you come up with a protocol wellness plan. Okay. All you have to do is either you or that person signs up as a member on the site. I will be your professional for a day. You've got 2 days to do this, maybe 3. Okay. So let's see what happens. But I will help you come up with a protocol wellness plan to help that person that you're helping, or if it's you, know which kit to start with, which oils to get in addition to that, how to order an LRP, how to start a daily routine with the essential oils, and where to go from there.
Did you all hear that?
I think it's a pretty good offer.
Do you know what that's worth? You don't get a doctor.
It's worth more than a copay, but but anyway, it's a start. But here's the other offer. If you guys have a professional that's wanting to support you and your team, have them come to our site. Have them become a professional member. Join as a member, and together, all of us, we can create wellness plans for all your the people that you want to share the essential oils with. So we can get them started and get them using them on a day-to-day basis until they just can't help it. They have to use these because it's really helping them with their condition. Okay? So this is the idea. We'll gather their health history. We'll recommend a starter kit based on their personalized health. We'll provide a day-by-day instructions for the first 2 weeks and instructions of what to do going forward. We'll guide them with placing that initial LRP order or monthly order of things that you might need in the future to do this and to get the discounts with doTERRA. And then we'll provide you that support during those 2 weeks. So if you're doing a protocol and you have issues that come up, we'll help you with those issues. We meaning the professionals, the premium members, or the wellness advocates, all helping the patients through this process, or the clients. So I've tried this. This works. I tried it on a friend, actually. Not a patient of mine, but a friend who I wasn't treating as a doctor, but who needed help, wanted to use the essential oils, didn't know how to start, had a very serious medical issue, and I helped create this plan. This friend is not from some other country. This looks like it's, some other language. It's coming through as a different language from a different planet. But this is a wellness plan. And what it is, okay, I'm gonna decode this. Here's a little message from the professional saying, hey, I want to help you with this. This has really helped me. Let's get started. Okay, this is a personal, individualized message. After that, there's a suggestion of where to start, what kit to get, which basic kit to get, and which other oils to add based on their health condition. After that, there's a suggestion of what they should order monthly to continue with prevention for their health. And following that is the protocol wellness plan, which is the day-by-day instruction. Day 1, start by applying the essential oils in this manner, topically, inhaled, internally, specific to that patient, and what to do during that first day. So they don't have to think at all. They just have to follow the instructions. Day 2, this is what you should do. Continue doing what we did on day 1, alter it if necessary, and add this. By day 3, 4, or 5, maybe we'll have them start using the supplements. We're not going to bombard them and have them use everything at once. We're going to have them start with the basics and then add. By the end of 2 weeks, they're going to be using everything they need to treat their condition, but also to help prevent any serious medical conditions. So that's the protocol wellness plan. This is a 2-page plan in a language from a different planet. We can do it on Earth. I know we can. actually work on Earth. Okay, so in summary, I want us all to learn more about the essential oils. So this is nature's medicine. The essential oils don't just smell good. They actually are complex compounds with chemicals that can be used therapeutically. We need to learn more about the research, either us doing it or us bringing a friend who likes doing that so that we can work together as a team. And I think that protocols.com is a place where you can do that. I think aromaticscience.com is also a place where you can do that. And they're different. So I think we need to engage our health professionals and make them and help them be part of this so that they can know what we're doing and better understand it and help us make those decisions. Help us know when we need to take antibiotics. Sometimes in our family, we don't ever want to take antibiotics. And it has to be a family decision. But sometimes you need it, okay? But we do need to be more patient. Okay, this is just a little treat at the end. These are some pictures of our family just to illustrate some principles. So I, as a doctor, run a very busy medical practice. I see anywhere from 20 to 30 patients a day. I do surgery 2 or 3 times a week. I have to somehow help my patients get better and help them be happy. And it's not easy to do. So I don't recommend you doing that not in a medical practice without all the ancillary support. I don't recommend any one person doing all this. But there are certain principles that we use as doctors to have a successful practice so that our patients walk away happy. Okay. And I think we can use those when we're using essential oils and sharing them with our friends and doing it as a business. We can share it. We can use these principles for them to be happy and for us to be happy, for us to have that wellness lifestyle that we're talking about. Okay. So number 1, face-to-face interaction. These are my kids with Santa Claus. Reminder calls, emails, texts. You want to establish that relationship so that they trust you and there's this mutual trust. Our kids trusted Santa Claus. Principles of a successful health practice. Educate. We need to educate the people that we're sharing this with so they understand why we feel so passionately about it and why it's good for them. The spoon feed thing is maybe going a little too far, okay, the force feeding. But sharing and having them ask the questions and then us sharing the answers to those questions rather than us coming up with the questions ourselves. Caring for them. This is me with my daughter looking at her ears. And she felt special because her daddy, who's a doctor, was looking in her ears. We need to help them feel important and special, and that we care about them. This is my daughter wearing my shoes. Who knows? Maybe she'll be a doctor one day with these experiences. Ayla. We need to take good care of ourselves. These are the kids in the sauna, getting some relaxation. Having fun in the sauna in Minnesota. And we need to know our limits. This is Ayla after Halloween. She obviously went past her limits. As doctors, this is a big deal. We are very busy, and you can burn out very easily, very fast as a doctor if you're not taking care of yourself and you're basically not taking care of yourself. This is a big picture. The last one, be honest with yourself. I guess here it is again, know your limitations. Know when you need help. This is Ayla at the emergency room. We do sometimes have to take our kids there. We probably didn't need to this time. I panicked. But you can see Ayla, even though she's not feeling good, she's having a good time. She's helping us to feel better too. So in the end, in conclusion, this is what I'd like you to remember. Learn more about the essential oils. Use them daily in your home so that you can know what to do. Be patient, and miracles will happen. Engage your health professionals, and above all, take good care of yourself. Thank you very much.
So turn the recording off.